Yeah, so I'm Clare Beesley, and just a little bit of background about me. I work in a large inner city hospital in Birmingham that has 4 sites, and my role is really to oversee the care and support of families wherever they are in our organisation, whether that be in our emergency departments, gynae wards, neonatal units, or our maternity unit. So covering all aspects of loss, whatever stage in pregnancy that be. And I've been a qualified midwife for 27 years, and 20 years of that have been as a bereavement midwife.
Wow.
So I've seen lots of changes over the years, and yeah, grateful of the opportunity to talk today about pregnancy loss and how the importance of caring for families. So, as you can imagine, this is a massive topic, and I could talk all day, probably all week actually, about how important care of bereaved families is. But I'm just going to give a little bit of a recap and then probably just explore a few aspects of this in more detail. Um, and starting with really why we're here and what the heart of what we do, and that is making sure that when a baby dies, that the care that the parents received is always led by what their needs are, and for them to be able to do that, we need to give families information so that they can make the choices and make the decisions relating to their care and the care of their baby that's led by them. One of the important aspects of this is definitely continuity of care so that families feel that they're in a safe space to be able to receive that information at a time that's right for them, and ask questions when they're ready. Environment's always an important thing, and in the busyness, as Sue's referenced earlier, in the busyness of our daily lives at work, it's so important when you are walking a family into a space, whether that be to break bad news or to care for them when their baby has died. Think about your environment, think about the noise, think about where you're taking the family, because those are things that they will remember. And we want families to come into our care knowing that we do really care about them, and the little things do make a difference. So yeah, just always have a look around you and think about what things you can change. And along with parent care, we also need to consider that we need to care for the whole family. There are siblings involved that have lost a brother or a sister. There are grandparents whose own children are grieving and they've lost their grandchild as well. So we'll talk a little bit more about that. And then one of the other things is just making sure that families know that we are caring for them. But just because their baby has died, it doesn't mean we stop caring for their baby too. And we'll talk a little bit more about that as well. Ongoing support. So we see families, or many of you here will see families in a snippet of time when their baby has died, but the aftercare and support that follows that is so important to how their family will grieve and progress in their journey of grief, that we will also reference, because it's important to remember that when a baby dies, that stays with a family forever, and their grief is a journey that they learn to live with. One of the things that I really wanted to discuss before, just to also start off with, is that you will see there is a diagram on the side that shows different pregnancies at different gestations. And it's so important that we recognise that you can't measure someone's grief by the stage they are in pregnancy. You can't compare someone, for instance, that's had 7 attempts at IVF and this is their last chance, and they've had a miscarriage at 6 weeks, against somebody who's had a term stillbirth, or a baby with a life-limiting condition that's going home and will die at home. These aren't things that we can measure. What we have to do is make sure that all families get the same access to support, the same access to care, and that care is then led by the parents. We do know, and this is why I've brought it up again today, is that we do know there are inequalities in care of pregnancy loss, and the recognition of the earlier losses in miscarriage care isn't the same. And you hopefully will have heard of the pregnancy loss review, and I think if you haven't, you'll hear more about it as time goes on. It was heard in Parliament, and there were 71 recommendations for trust to follow, which will hopefully make sure that families that have had a miscarriage get that same access to care and support that they deserve. So one of the things that I think was so important to talk about, and just to speak a little bit more about, is that parent-led care and how we give that parent-led care. So at a time when a family are devastated and have been told the news that their baby has died, they need information. They need open and honest, sensitive information, and they need time to absorb that information. So giving a family lots of information just as they're being told that their baby has died, they may not be ready to receive that information. So it's also about reading the cues for when a family are ready to receive that information, and allow them constant, time for questions and information, and reiterating information about what's going to happen to them and what to expect next. What's also very important is that we discuss with them what to expect about what happens next. So what to expect in their labour and birth, the pain relief options that are open to them, how long this may take, and even if we don't know how long it may take, giving them some timeframes around that about possibilities so that they're not shocked by anything that happens. Making sure that they know where they're going to be cared for, and if that place of care may change because the mom's condition in her health changes, that they're prepared for those changes in place of care. And then broaching the difficult subjects of them then spending time with their baby and the memory building all around that. We've mentioned continuity of care, but this just reiterates really the need that of how important this actually is, so that families feel safe with the people that are caring for them, that they don't have to keep repeating what they've already said, and that it builds up a trusting relationship so that the families feel that they can ask questions that they may be really frightened to ask because they don't think it might be appropriate to ask. And that's all about that continuity of care and relationship building. Talking through memory building and having time with a baby is also really important to discuss at a time that's right for a family. And again, anything that we've discussed with the family, any updates, it must be documented in that individualised bereavement care plan for the family, so that if healthcare professionals are involved in their care, that they've already read upon this, that you go into seeing a family already knowing what they've discussed, so that the family don't have to keep repeating themselves and explaining everything all over again. Care of their baby. So as I've said, it's really important that parents know that just because their baby's died, it doesn't mean that we won't be caring for them. And the little things make a difference. If a family have named their baby, and they may well have done earlier on in their pregnancy, say their baby's name, write it down, make sure people know what their baby's name is. And if their baby's in the room, spending time with them, acknowledge their baby. Don't walk around and ignore their baby. That's their baby. Take time to go over, recognise that, talk about the baby, talk about any hair they might have, their tiny little fingers or toes. Make sure that you just talk to the family and give them the opportunity for the families to talk back and open up them conversations. I think we all know the importance of memory making and giving families that opportunity to make a lifetime of memories in a very short amount of time. And it's important to involve the family in that if they wish. These aren't our memories, they're a family's memories, and it's important that if they wish to be involved, that they do so. Having time with their baby afterwards is, again, led by a parent, and they need to know that that option's there for them, and they need to know where their baby is at all times. And even when they've left the hospital, they need to know that they can come back and see their baby if they wish, or where their baby will be cared for. When families do choose to keep their baby with them for a prolonged period of time, it is important to have those sensitive discussions about care of the baby and preparing the family for the changes that may take place in their baby. And again, whatever the choices are, that's a family's decision. There is no right and wrong. We're there really as healthcare professionals to give families the information and then support their decisions. When a baby dies, there are often sometimes siblings involved, families and friends, and we often see children coming up to spend time with their sibling, and again, that is an important consideration. But as healthcare professionals as well, we also need to be aware of how to support the children, how to give the parents advice about how they may want to approach telling their children that their brother or sister has died. And again, we're there to support them. It's also important to consider the support networks around a family and making sure that they have access to information and support for them so that they can support their loved ones too. I think it's also important to acknowledge that some families don't have those support networks too, and we need to think more about other issues that may complicate a family's grief, whether that be that they're new to our country and they haven't got any support networks at all, whether there are relationship issues and there is conflict within a family. All of these things are things that we need to know about and understand and support a family in whichever way that we can, and that includes cultural and religious aspects as well. I've mentioned this earlier about when a family go home, the aftercare and support that is available is very, very important, and it's very important that we offer individualized care and support and recognize that this may be changing, because as a parent navigates their way through grief, their needs may change. The access to them wanting to access support may change. Other things may happen in their life that may lead them to wanting to access support when they didn't want it to before. So it's all about individualizing that care, but making sure that families do have the opportunities to access support in them weeks and months ahead. And our role really is to support the families, but also to signpost them to the amazing charities that are available locally and nationally. And sometimes that means that those families that are particularly struggling, sometimes they just can't pick up the phone themselves or make that first contact. So as healthcare professionals, we're there to do that and just help them make those first steps in accessing that support. It's also important to discuss what grief may look like to a family, the emotions that they may feel, the shock, the disbelief, the anger, the tears, the numbness. All of these things are going to feel very abnormal to a family, but we do need to normalise and prepare them for what they may be feeling. And alongside that as well, and this again goes with continuity of care and why it's so important to have bereavement leading services, is that continuity of care for a family, and knowing that you may have more concerns about a family that you already know about and how they've changed or their inability to function with daily life. It's all about recognising that and making sure that families can access mental health services as well. And also communication with our colleagues in the primary and secondary healthcare sector to make sure that this is a whole package of care and support, not just from one area, that everybody knows about the loss and everyone's there to support the family. I've just put up there some of the things that we use locally, some local and national support services, but we're not here doing this alone. The charities that are available are immense, and they are all tailored towards individual needs, and there is some amazing support out there. But we do also need to recognise that families that experience baby loss, we know that it can affect their mental health. They may have increased anxiety, there may be some post-traumatic stress, and it's just about recognising that and making sure the families get the right individualised treatment for them. I don't know whether anyone will have seen this, but I have shared it with Sue. This is a very short video that summarises an important step forward in bereavement care. When I very first started in bereavement, it was very much around that time when a family were in the hospital. And then it's sort of gone towards the, really good aftercare and support. But now that's grown again, really, into recognising that when a baby dies, a family will go through a whole journey of grief, and that their life will learn to live around that grief, but that grief is always there. So when we see families in subsequent pregnancies, when we need to understand that there might be increased anxiety, there might be triggering moments. So always look back at someone's history and try and understand why someone might need that extra care and support. So yeah, if you do get a chance, watch that, because it's only a few minutes, but it tells a whole story around the journey of grief. And how we do all of this is a difficult job to do, and it is very challenging for staff, and it is something that does affect staff, and we know that, and that's because we're caring and we don't want to see a family go through that, so it does impact us as well. So it's really important that we recognize that, and we take some time to just take a step back. Don't be frightened to seek support. It's normal to want to offload sometimes to someone, to reflect with someone. Reflective practice, I think, is always such a really good thing to be able to do. Acknowledge your own feelings, your own challenges, and also acknowledge your own training needs. If it's something that you're worried about, go and try and work with your bereavement team if you have one, and just expose yourself to more information, more training. And also, if it does happen in the workplace, always just check in with each other before you leave for a shift, to just see how you're all doing. And I think a lot of people do get their support from their colleagues who have that understanding. And that's it from me, a very short whistle-stop tour of bereavement care. So yeah, thank you for listening.